Hello, my name is Jack Giacometti. I work for Clinical Counseling Associates, a group of clinical therapists and counselors in the Kansas City area. We have over 20 clinicians in a multitude of specialty, and we presently have 2 locations, soon to be a third. Our featured clinician today is Montana Bright. Montana is a graduate of the Missouri State University in Springfield, where she holds a master's in mental health counseling. Montana is presently also a PhD candidate, focusing on sex therapy certification and her doctorate in clinical sexology. Montana, most of the public's perception of sex therapy is colored by the movie and TV entertainment media. They represent this field in a whole spectrum from couples therapy to sex surrogates. Can you give us a better and clearer view of what sex therapy actually is?
Sex therapy is a psychotherapy, which is essentially just talk therapy. So I meet with people to kind of gather some information on different sexual dysfunctions that might be coming up, and it can be a very wide variety of things. So I see couples who have been together for 40 years and have a huge loss of intimacy and connection. Maybe they're really great in communication outside of the bedroom, but in the bedroom things just aren't really clicking like they used to. I see a lot of people who have interest in BDSM and kink, a lot of people who are interested in polyamory or swinging, desire discrepancies, erectile dysfunction, premature ejaculation. All of those things can be discussed in sex therapy. And with those things, typically, yes, there might be a medical factor. And so in the sex therapy world, we typically say that as long as, there's no pain, then you're perfectly healthy and normal. And everything you're going through could just be a psychosomatic piece and worked through with psychotherapy and also specific suggestions. So it's not just we sit down and we talk about all of these ins and outs. I also give what people would call homework assignments to take home and practice, especially if you're in a couple or even if you're on your own and you're just wanting to explore your own sexuality. Another piece of sex therapy is sexual identity. So I do a lot of work with trans folks and non-binary folks, specifically adolescents and their families. And being in the Midwest, that's kind of a tricky piece to work with, but probably my favorite part of doing this job is working with that specific population. So on top of desire discrepancies, intimacy loss, sexual dysfunctions, I see a lot of couples who have experienced infidelity in their relationships. And it can be, a one-time thing or an ongoing affair. It's a lot of affair and trust recovery in that. And there's a lot of specific suggestions, but mainly, kind of talking through the pain that the hurt partner maybe has. And in my experience, I would say 8 times out of 10, they end up feeling more confident and closer than ever if they come to sex therapy and work through those things, which is hard for a lot of people to wrap their head around. And I completely understand because we have this taboo look of what affairs really are in media and society. And they're so much more complex than just, I wanted to have a one-night stand and cheat on my spouse. No, there's layers to it, and we can work through those and really regain that trust and connection. People honestly tell me that they feel better about their relationship than when they first started dating. I've had a couple clients tell me that. I think that's really beautiful.
So do clients work through issues mainly with talking? I mean, I'm addressing people that have preconceived ideas about what treatment they think they will receive when they go to a sex therapist. Can you please give these clients an idea of what is real and what is not, and is centralized in treatment by what the media kind of shows on TV and what people think sex therapy is?
Yeah, absolutely. So I will say the media piece, the only show I've seen that has similarities is the show Sex Education on Netflix. The way they talk about sex therapy is pretty similar. It's the closest I've seen anyway, and their messages that they give, fantastic. So I would say, yes, we work through things with talking, get to the baseline. I do sex histories with people, so asking pretty intimate details about, maybe the first time that you ever had sex, your first sexual experience, what sex education was like for you, whether that was through friends, through family, through religion, and work to really kind of get an understanding, a framework of how your sexual erotic maps were formed, essentially. And then when I have that information, I would give specific suggestions. So homework assignments, again, that are really vary depending on the issues people are coming to therapy with. And then you would practice that, come back, tell me how it went. If it didn't go anywhere, there's some resistance there. We work through that. Some people, you know, it's quick, it's wow, that was fantastic. And some people need some more intensive therapy. They have, you know, maybe religious trauma or sexual trauma that's going to make it more difficult to surpass some of these blocks that they have in their mind. Not to mention, we live in a very sex negative culture. And those are really hardwired in us pretty much from the day that we're born. It's just the messages we get through TV, through friends, through just the history the United States has on sex in general. We're set up for failure, essentially. And so my job in that case would be to come in and kind of give some actual facts, the things we should have learned in school, but we never actually did, in order to help kind of push past those blocks and have everybody live in a more sex positive and more comfort and confidence in their own bodies and pleasure.
Well, thank you very much today, Montana. I think that you've kind of explained a little bit more about what sex therapy is, and perhaps, hopefully, give us a better understanding on, you know, how safe it is and destigmatize it. Is there any final words that you have for us today?
Yeah, I would say that I talk about this stuff very nonchalantly because it's essentially all I talk about all day, every day. But I understand that it's scary and hard to talk about. And I'm sure, you know, making that first session, that's kind of the hardest part, is just showing up, making the session. And once you actually get through the door, it's a lot easier. And I hope that you'll know that I'm not quite as scary as it seems. And yeah, that's really it. If you're interested at all, I do open consultations. I'd love to, you know, float some ideas around with people before, if they're a little nervous about coming in. They can call our receptionists and have conversations about that too. So yeah, if you're interested in it at all, please reach out. I'd love to help.
Thank you for watching this video. We hope that you've gotten some information out of it. And remember, we are clinical counseling associates based in the Kansas City metro area. We're available for you. Like I said, we have many clinicians with a wide variety of modality and specialty. How can we help you today?